So let's touch back a little bit more on who are the women that should highly or strongly consider adding in menopausal hormone therapy. So based on our current guidelines, and again, these are evolving, so stay tuned. This is being filmed in 2026, but certainly stay tuned. Right now, the benefits of menopausal therapy are very clear in women who are within 10 years of menopause, that is your last menstrual period, and under 60 years old. Specifically, benefit seems to outweigh the risk for most women with those vasomotor symptoms I mentioned. But also a really big one is if you have genitourinary symptoms of menopause. What does that mean? Dryness, itching, burning of the vagina due to dryness, pain with intercourse, or recurrent urinary tract infections. This can respond so well to a very, very low risk treatment, which is vaginal, that is topical estrogen. The black box has, as of 2025, been removed from topical estrogen, and the risk of systemic absorption and other risk associated is very, very low. Most women do great with vaginal estrogen. Generally, you use it more regularly for the first couple weeks, maybe daily, and then 2 to 3 times or as you need it after that to maintain and support that mucosa. For women with recurrent urinary tract infections, even just putting a pearl-sized amount around the urethra can be such a big deal in helping to prevent urinary tract infections that so often warrant all of these antibiotic prescriptions that are, as we know, so detrimental. Unnecessary antibiotics are so detrimental to your microbiome, which is, again, playing a major role in how you metabolize and regulate your estrogen. So again, that's a really important thing. Vaginal estrogen, I think, should be given and prescribed, or at least asked to every single woman. But those are the 2 major indications. Of course, if you went through menopause either through surgery or naturally prematurely, in other words, prior to the age of 40, there's a good indication for menopausal hormone therapy, as long as there's not contraindications, as in specific cancers and so on. And also prevention of bone loss. So menopausal hormone therapy is not used currently for treatment of osteoporosis or bone loss, but if you're at high risk, it certainly does help to support the bone and to prevent further loss. And of course, the best thing is to do this if you choose to do that, but also look at what you can do to support your bones from a lifestyle movement perspective. We'll talk about that, but resistance training, jumping, we'll give you specifics on what that could look like regardless of who you are and your comfort level. So of course, stay tuned for other indications. As it stands now, menopausal hormone therapy is not indicated for Alzheimer's prevention or longevity or other things. There's still a lot of data that needs to be done in order to clarify that, but I hope that gives you a good understanding as to where we are at this state.